Number one thing, don't take advice from some asshole on the radio.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and now a podcast. Now a podcast, only for the last 10 years. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who keeps the weird alternative medicine assholes at bay. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who would never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. And visit us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Or go to our merchandise store at cafepress.com/weirdmedicine. Just go there if you want to get a Bristol stool scale mug. I mean, we make 20 cents, so don't worry about it. But it is hilarious. That's a great gag gift. You know what else is a great gag gift, Dr. Scott? A Flatus flute.
Oh, no, those are the
You can go to flatusflute.com and order you a whistling butt plug. And don't use it. Just put it in people's stockings as a gag gift, at one of those parties. Not at the office. It's not safe for work. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. Yeah, do I have to say that in 2020? Don't take a Flatus flute to the office, holiday party. Because you're going to get your ass fired or have to go to sensitivity training. Flatus flute. Flatus flute's hilarious, though.
That is pretty funny.
It cracks me up thinking of Son of Fritz's artwork on that.
He's a hell of an artist.
He is really quite talented young man. And
have we heard from him?
I haven't heard from him in ages. I don't know whatever happened to him. Yeah.
Yeah, he used to call all the time with questions.
But he, his that style that he did on there is sort of Ren and Stimpy style. Mm-hmm. So just imagine a Ren and Stimpy style Dr. Steve with a Ren and Stimpy style ass cheeks, close up of ass cheeks. So you're sort of looking past the ass cheeks to me with, the spiky hair and all that stuff, farting out musical notes in my face, and I'm grinning like it's, it smells like flowers or perfume or something. That's the stupidest thing.
That is pretty stupid.
And they're cheap, too, but flatusflute.com, buy 10 of them. All right. Dan, who makes them, is hilarious. So check out stuff.drsteve.com for all your Amazon needs. Just go to stuff.drsteve.com. It's holidays. Please, the more you use that, the easier it is for us to keep doing this stupid show. Well, that might not be a good thing, and then if you need a case of wine for the holidays, go to wine.drsteve.com. You'll get a better deal there if they ship to your state. I bought $250 worth of wine from there for like $80 the other day. It's all small vintners. And it is it's incredible. We have been nothing but happy with that. And I placed my order on Monday. We've got it by Wednesday or Thursday. Tweakedaudio.com, great stocking stuffers, the best earbuds for the price. And if you use offer code FLUID, you can buy 3 and get it for the price of 2. Or you can get 33% off 1, whatever. And then if you need to lose weight before the holidays because you're going to gain weight, during the holidays, go to Noom, NOOM.drsteve.com. You get 2 weeks free. Try it out. It's not a diet. It's a psychology program. If you like it, you can continue. It's a 3-month program. You pay for it. You get 20% off if you use Noom.drsteve.com. And then just don't forget to go to Dr. Scott's website at simplyherbals.net. Now, if you want one of these masks, do you have one, Scott?
I don't think so.
Okay, well, here you go. You
Oh,
can
thank
have one. They're Weird Medicine masks, and they're work against COVID-19 as well as anything else any other masks do. And they got the Weird Medicine logo on them. They're
beautiful.
We only had 75 of them made, and we're down to our last 20. So if you want one of those, you can get it free with the purchase of the Weird Medicine Archive. So just go to drsteve.com, click on the link that says get all of these shows on a thumb drive. You get a 32 gig thumb drive with 430 shows at this point on there, and a little bit of extra stuff, and then you get the face mask, and then Tacey and I autograph some stuff, and now that Scott's back, we'll get him to autograph a thing or two, and we just throw some Chotskys in there sometimes. So anyway, go to drsteve.com for that. All right, well, good to see you two again today.
Glad to be here.
Sort of glad to be here, kind of, sort of.
Yeah, well, I was thinking we weren't going to be able to do it today because I was supposed to have a frigging root canal. Ugh. And once again, the endodontist begged off, saying, look, you're going to lose the tooth anyway. Because apparently I grind my teeth when I'm sleeping.
Okay.
And I only recently kind of figured this out, and no, none of my dentists or anybody's ever said, hey, maybe the reason that your teeth keep fracturing, it's always the rear molar. And I get that one removed, then this one removed. One time, the first time this happened, they put a temporary crown on. Then I went to the endodontist. They're the ones that do root canals, and she went in and reamed out the nerve root and all the blood supply and everything, and then they put this gutta percha stuff down in there and cram it in. And then I had the crown put on. So now, so the root canal's $1,200, the crown's $1,200, right? Mm-hmm. So I'm $2,400 into this. And then after maybe 2 weeks later, the pain came back. Ugh. And I go in to see the endodontist thinking, well, maybe she needs to repeat the root canal. She's like, nope, you just have to have a tooth extracted.
Oh my
so then it was another $400 for that. So it was whatever that works out to, it was about a $3,000 tooth extraction.
Jeez.
So the last time I had it, they said it was going to be the same thing. I can do a root canal, but you're going to lose the tooth anyway because I keep fracturing the most rearward molars. And when I was a kid, I had these fluoride treatments that kept me from ever having a cavity.
Right.
But I think it made my teeth brittle. And with all the stress and all this crap, and of course, then I'm older, so 65 years of grinding my teeth, I guess, that I wasn't even aware of. Now I'm just breaking my teeth. So I was supposed to have one today. And she said, no, you're going to lose the tooth anyway. And, it might be 6 months from now. It could be 2 years from now, but you will lose the tooth. And so it was like, I was like, well, so what should I do? And she's like, well, it's kind of 50-50. And it's like, well, then hell. But now I got to have damn implants because when I lose this tooth, now I don't have any molars on that side. So now I'm just going to have implants, which should stop this from happening. Right, because now the implant will take the brunt of the damage that I'm doing when I chew and stuff like that. And I'm wearing mouth guards now, so hopefully that'll be the end of it.
How much does an implant hurt?
Yeah, don't even. Oh, how much does it hurt? Now that I don't know the answer. If anybody's had this done, feel free to call in and scare the crap out of me. It's fine. But it will hurt less, I guess, than having just a chronically, fractured tooth. And it's not the fracture that causes the pain. It's the bacteria that work their way down that fracture line and then cause inflammation that causes the pain.
Yeah, because the tooth is spread out a little bit, I guess, and puts pressure on the nerves.
Yeah, well, that too.
I would assume,
but really, where the fracture line is, bacteria are, they're microscopic. Sure. The fracture is not. You can see the line. So they get down in there and work their way down into the root area, and then the body comes in and go, what the hell y'all doing? And get the hell out of here. And then it causes inflammation, and the inflammation is what causes the pain. So as long as I stay on the antibiotics right now, I'm okay. Mm-hmm. But I can't stay on antibiotics.
No. So we need to get you some good edibles for nighttime. If we were in a state, of course, that had edibles,
that would be good.
And keep you from grinding your teeth.
Well, the mouth guard will keep me from grinding my teeth too. But yeah, I'm up for that.
Yeah, buddy.
Listen,
I know people.
I am a libertarian. I think that it should be completely legal.
Well, Virginia is talking about legalizing it.
They did legalize it.
Yeah.
For medical use up to 10 milligrams.
Talking about now recreational use.
Oh, really?
Yes,
okay.
It was on the news yesterday.
Okay, awesome. Because we're right on the line, so I'm assuming you can go up there and just get you some, come back down. But it should be. It should be legal across the country, and it needs to be declassified from a Schedule 1 to a non-scheduled drug, and like alcohol, and just make it legal, and then tax the shit out of it, and put the black market side out of business. I'm okay with that. I guess people who make a living in black market transport of this substance probably wouldn't be happy with me saying that, but they could just turn around and get into the legal business. They'll make more money, and it'll be a lot less risky.
Yep.
Because if you're transporting and you could get busted.
Oh, shoot, yeah.
You lose the whole shipment. This way, you just pay your taxes and you just go on your way, never have to worry about getting busted.
Yeah, it makes a lot more sense. But I can't believe you grind your teeth that darn bad.
I can't believe a dentist hasn't done anything about it.
Yeah, I'm surprised that they didn't say something after the third time this happened. I had to figure that out on my own. But she said, well, have you been under more stress lately? And I'm like, seriously?
Just look at her and laugh?
I did. That's exactly. I went, no, I'm fine. Everything's fine.
Just fine.
Just fine. Did you make your own mouth guard, by the way?
No, I'm. So far, I've been using the disposable ones from like Walmart, or Walgreens. You wear them for 3 days, but it absolutely keeps me from grinding my teeth.
Yeah, your neighbor here, back when I was in high school, I broke my jaw, and he goes, well, you got two choices. I can either make you a mouth guard for about $600. You can make your own.
Oh yeah, how did he say to make your own?
Well, and I went and bought a little the football mouth guard. And made it myself, and then just trimmed the edges off of it, so at nighttime it's not so bulky.
Yeah,
shoot, it's perfect.
Well, they have the ones in there that are reusable, and you heat them up in boiling water, and then you clamp down on them. I would be interested. Any dentists that are listening, I know we have dentists that listen because they reach out to me from time to time. Any thoughts you have on this, particularly home remedies like that? I'd be very interested in.
Yeah,
because we don't learn anything about teeth in medical school at all. I know nothing about dentistry.
I think my mouth guard costs $300 or $400.
Yeah, what are they?
And what
are they charging you for?
To me, it's worth it.
Yeah.
The molding, the time, I guess.
Okay.
Or you could make one just like it for $7.
Right. Well, that's the thing. So
I tried that; it didn't work.
Is there a demonstrable difference between those? And the dentist will have a vested interest, but I would like to hear what the evidence is on that.
Well, non-biased El Cheapo me.
Yeah, and the CVS disposable ones, you have to throw them away every night, and they're harder than the Walgreens ones. I like the Walgreens ones better, so there you go. I didn't think there'd be any difference, but there was.
We'll have to make you one during Thanksgiving. That's what we'll do.
All right. Okie doke. We have news.
Yeah.
You want to?
Lots of good news.
You want to talk about it?
Hey, you've got it pulled up. You started.
Oh, for God's sake. I just want to be Howard to your Robin. And
okay, give up on that, because that's not going to happen.
But Tacey she does it.
I didn't do it this week.
No. But
for 15 years, he's wanted that to happen, and he's over 15 , so at least...
Yeah, it's not that I want to be Howard Stern. I just want...
somebody else to do some work.
These people... No, it's not even that. Just to read the news stories and let me comment on them rather than having... But it's okay. It's never going to happen.
Hey,
You're right.
There's a news story.
What do you got?
There are a couple viruses. Going around, and then, but that's not what I meant to say. I meant to say there's vaccinations coming
Yes, that is true. There
Going
are two. And I think Pfizer, by the time this airs, Pfizer may have requested approval from the FDA. They needed to reach 162 cases and then do the statistics on it. And they just passed like 175 today.
Cool.
So what they did was they had 40,000 people, 20,000 got placebo, and 20,000 got the vaccine. And after they did the final analysis on effectiveness, the vaccine met all of their primary efficacy endpoints. So what you got to do is you got to say, look, we got to get to this level before we can ever say that it's statistically significant. And the more effective it is, the quicker you can get there. Right. So if it's 55 to 45, you've got to do a lot more cases to say, wow, this really is effective compared to the other one. And that's crappy, right? 10% better. But in fact, they hit 95% efficacy rate. In other words, that it was 95% effective in preventing infection with the p-value of being less than 0.0001. So it's 1 in 10,000 chance that this could be by random chance, and we'll go p less than 5%. We consider that statistically
Very good.
significant.
Yeah.
So that would be what 5 times in 100. But anyway, so let me see. Let me get the numbers here. So the first primary objective analysis is based on 170 cases of COVID-19, of which 162 cases were observed in the placebo group versus 8 cases in the vaccine group. So that's huge. So the efficacy was consistent across age, gender, race, and ethnicity. And the observed efficacy in adults over 65 years of age was 94%. Okay? There were 10 severe cases. Severe cases are people who not only are in the hospital but need respiratory support. And during the trial, 10 people were that sick, and 9 of the cases were in the placebo group. Only 1 in the vaccinated group. So that's awesome. Now, their case rate was pretty low. They had 40,000 people and only, 170 cases. So hang on a second. Echo, what percentage is 170 of 40,000? See if she understands it that way.
170 is 0.425% of 40,000.
Yeah, so it's 0.4, like less than half of 1% actually were infected. Now, that's people that they know about. Somebody asked me about it. Well, what about asymptomatic cases? Well, I participated in the Pfizer study. Unless you serendipitously got a COVID test that came back positive, they would not be aware of you. So this doesn't correct for or account for asymptomatic cases, either in the placebo group or in the treatment group. Because the way that the protocol went was if you got symptoms, like if you got a cough or a sore throat or a fever, you would enter it into this app and say, yes, I have that. And then they would immediately ask you to shove the probe up your nose and send it to them. And then if you needed to go on and get treated, then you would do that. And then they would follow up with you.
Okay.
So they're looking at symptomatic cases. Do we care about asymptomatic cases? We do, in the sense that they're wandering around maybe infecting people. But the truth about asymptomatic carriers of this is that the transmissibility without them snotting on you or coughing or, breathing heavily on you or being in the same area as you are within 6 feet for more than 15 minutes is very low. So people who are symptomatic can infect more people. People who are asymptomatic will infect less readily, but they're in contact with more people. Because if I'm symptomatic, I'm going to isolate myself, right? So it kind of evens out. So we do care about asymptomatic people, but this vaccine is really just telling us right now about people who, were symptomatic. Now, Pfizer could later on go and call all of us in and draw antibodies and see which people went from antibody negative, because they did that in the beginning. They drew antibody titers on all of us. And now, how many people went from no antibodies to having antibodies but never had symptoms? So that's a confirmed asymptomatic case. And then they could look and see if there's a difference between groups there, too. And I would predict that there would be. But it's very interesting.
What about the people who are not going to get this vaccine because they feel like it's been rushed?
Right.
Or that it's Bill Gates' vaccine and it's got a chip in it.
Right. Okay. First off, we don't have the technology to put chips that are that small that could do anything to you and put it in your arm, in a muscle.
I don't know, Steve.
Yeah, I do know. I do know. So we don't have that technology yet. These machines, these viruses are just little machines. They're submicroscopic. You cannot see them with a microscope. You need an electron microscope to see them. And the mRNA fragments are even smaller than those, because it's just basically the instructions on how to make the spike protein. So you've got these little mRNA fragments. So it's even smaller than the genome of the virus itself.
Right, because it's part of it.
Right. Yeah. So to somehow put a machine in a syringe, a 30-gauge syringe, and inject it into you and do anything with that. It's not like it can broadcast to a satellite to tell people where you are. Even if it worked, like you could somehow put an RFID chip in somebody, you'd still have to walk by a scanner.
It doesn't
like your credit
transmit.
card.
Yeah, it doesn't transmit. No,
how's it going to transmit anything?
Exactly.
It doesn't have a battery. It doesn't have an antenna. I mean, it's just that's not possible.
Well, I believe my mother is part of that group.
Your mother is, yeah.
I believe she is. I don't know if she still is, but she was at one point.
Your mother's not a smart woman.
And
she's challenged.
Yeah. I mean, she thinks you make lasagna with retardo cheese, and she thinks the coffee drink at McDonald's is called a floopy. So I'm going to not worry about what your mom thinks. As a matter of fact, we don't have to worry about whether she takes the vaccine because she's already had the.
But she is not alone.
That's right. That's the problem.
I did read where, in order for a vaccine to be effective, and I can't remember where I read this, or specifically the numbers. So
I know the numbers. But go
80
ahead.
to 85% need.
Nope.
To take it.
Not in this case.
Okay.
So let's walk through the math. For us to achieve the first threshold for herd immunity, right? Because that's what we're going for, is herd immunity. We have to do, there's a formula for that, and it's 1 minus 1 over the R sub 0, okay? So the R sub 0 is the theoretical transmissibility of a virus. And for SARS-CoV-2, or SARS, the virus that causes COVID-19, that number is 2.4, which means that if you have a person with this virus and you put them in a population that is vulnerable, right, then they will infect 2.4 people on average. Now, there will be somebody who will infect 90 people, and then you get a whole bunch of people who won't infect any. The so-called super spreaders, but they're evened out by the number of people that don't infect any, or maybe just infect one person. So it's 2.4. So the number we're looking for is 1 minus 1 over 2.4. So I can't do that in my... Well, let's just say it's 1 over 2. So it'd be about 0.5. So 2.4 is slightly higher than that. So it'll be slightly higher. It works out to about 56% of the population. If they are immune, then we will achieve the threshold for herd immunity, which simply means that the threshold would be an R sub T, which is the actual number that people can infect, would be 0.9. So 1,000 people would infect 900 people. Those 900 would infect 810, and then 720, and then 640, et cetera. Right? Okay. So Now, that isn't going to happen. That won't make the pandemic go away overnight because each one of those generations is about 21 days long. But still, it will inevitably go away because it doesn't have anywhere to reproduce.
Right.
Okay. So now the R sub T's in most of the, if you can go to rt.live and you can see the R sub T of your state. So rt.live. Let's just go there right now. Okay, there's one state that's below 1, and that's Mississippi, and their R sub T right now is 0.9, which means that they are, as a group, transmitting the virus at a rate that will eventually end in the virus's decline if they keep up like that. So 0.9, again, 1,000 people would infect 910, infect, or whatever, 900, and then 810, and then 720, et cetera. The highest one right now is Vermont at 1.43, but there's still, none of these are close to 2, which is where when you have 2, that means 100 people infect 200, which infect 400, which infect 800. So you see that geometric climb. So we need herd immunity to be at 55% or greater. Now, there's already a bunch of people that have been infected, right? So 3% of the population has had it. Cases. That means 97% haven't. But there may be as many as 15% of people that have been infected but were just asymptomatic. We don't know that number, but let's say it is 15. Then we only have to get 40% of people who haven't already had it. Right? There'll be some overlap. Right. Who already haven't had it to get to 55%.
Right.
So we don't have to have 80, 90% of people, but I think most people, when they see how effective this thing is and that it could spell the end of this and we can go back to normal, people will line up for it. Now, has it been rushed? The answer is I would be the first to tell you if I thought this was rushed. I do not believe that it has been, and I'll tell you why.
I agree.
This happened so fast because the technology is completely different. When you want to make a normal vaccine back in the day, and we will never go back to this again after this, you had to find the protein that you wanted to make antibodies against, a foreign protein that the body would make antibodies against that would block it. So we have that for coronavirus. It's the spike protein.
Right.
So if you block that, it can't infect you. Then you would have to find the DNA or RNA that caused that spike to be built. And then you would have to insert it into the genome of, say, a bacterium or some other living thing that would then start producing this in quantities. Okay? And you'd have to maybe grow it on cell culture on eggs, or some cell culture that had nutrients in it. That's why people who are allergic to eggs can't take certain vaccines and stuff like that. And then you got to harvest enough of it. Then you got to purify out all the shit that the bacterial turds basically that these proteins were produced in. And then so that introduces other problems because the way that you clean it can introduce some chemicals that people could be sensitive to, and the little just nano impurities that are in that can also cause people to be sensitive to them. And then you have to get it in quantities enough so that you could make billions of doses or hundreds of millions of doses, however many. And it's hard to do. They're living things. Well, this, they just manufacture it. It's just mRNA. The messenger RNA is just instructions to the body's cells. Here's how you make the vaccine. So, and there are machines that will synthesize mRNA in quantities, and you just scale up, and you can make as much as you want. You make gallons of this stuff.
Right.
And so when you inject it, this messenger RNA, it gets inculcated into the cells of the human body, which then go, oh, it's mRNA. We're supposed to make proteins with this. So there are these other cool machines. If you want to see something cool, look at just Google image or go to YouTube and look at messenger RNA animations and how it works, because there are these machines called ribosomes, and they have two lobes, and the mRNA goes in, and then you have these transcription RNAs that come in, and they'll attach at the right place, and then the proteins will be attached to those, and then they will unhook themselves from the transcription RNA, and then the proteins will link together. And when you do enough of those, they'll fold up into the protein that you're looking for. It's incredible. Yep. It's just like having a deck of punch cards that you had maybe in computer lab 40 years ago, right?
Right.
And all of this is going on millions of years before humans ever learned anything about punch cards, about manufacturing things, about what proteins were. All of this stuff was going on. So anyway, and then it advances to the next one and the next one and the next one. It keeps adding more and more proteins. And that's what mRNA does. And then when the protein is done, there's a stop code on the mRNA, and it stops and it releases that protein into the cell, which then expresses itself on the surface of the cell. Well, guess what that looks like? It looks like a damn infection, right? So you get not only humoral immunity, antibodies made against it, but you get cellular immunity where cells come in and learn it. You get your memory T cells and killer T cells, and all these things start activating. And so it looks like a real infection, so you get better immunity that way, in theory. So that's why this was able to be done so quickly, because the technology, it's much cleaner, much easier to manufacture just strands of mRNA and have the body make the vaccine itself. Yeah. The mRNA isn't the vaccine. Right. Technically. You're injecting the instructions on how to teach the body to make the vaccine, and then you mount an immune response against that. So, and the next virus like this we get, we could do it even faster this time.
Yeah, you know what this reminds me of? I'm having a flashback of 15 years ago we were talking about cancer and immunotherapy.
Yes.
And how we used to think it'd be 50 years, and now with advances in technology, and we can use the foundations from these other viruses that we've had in creating more medications. And it's
when we started this show,
incredible.
In 2004, 2005, I was saying it's going to be 100 years.
Oh yeah.
Before we get immunotherapy that's at the technological level that I was looking at, which is, taking tumor proteins out, exposing people's white cells or their T cells and their different memory cells to that, and teaching them to kill the virus, and then injecting them back in, having them multiply and divide, and then just killing the cancer perfectly.
Yeah. And then letting the body do the work for you.
Yeah. And I said it was going to be 100 years, and then it was like 50. Yeah. You're right, just like you said, and then 20, and now we're doing it. There's a commercially available version of that for certain cancers right now.
And you heard it here first.
That is kind of true.
That's very true.
And the other thing they heard here first was I will pat myself on the back. Back in February, I looked at the phases and said, it's going to be around mid-October if all the chips fall in the right place and the dominoes, whatever metaphor you want to use, we should be completed with phase 3 of some of these trials, either Moderna or Pfizer, by mid-October. And I was off by a month, so I don't think that's too bad. No. And some of it, I swear, it seems a little fishy that they waited until the week that they did to release this. But okay, I'll give them the benefit of the doubt. But remember, politics plus medicine equals politics. So any decision that was made that wasn't for the benefit of mankind as a political decision.
Political, that's right.
And some political decisions can be made for the benefit of mankind, but you know what I mean. When it comes to medicine, if it's not in the benefit of the patient, then it's a political decision.
Thing,
but we'll never know unless some whistleblower comes up with a memo that says don't release no information until after Tuesday, November, whatever.
And I'm sure somebody's working on producing that right now.
Maybe so. Yeah, these days it's hard to believe any evidence because you can fake everything. Did you remember that movie Red Son? It was a Michael Crichton book or a Michael Crichton movie, and what it was they faked evidence.
Okay.
And what they did was, and this was, gosh, he wrote this maybe 20 years ago. You might look and see when he wrote that, but he always had one idea. Like for Jurassic Park, the idea was you could take DNA from amber from mosquitoes that had bitten dinosaurs and then make dinosaurs out of that.
Oh.
And then Congo was about, and they totally missed the boat in the film, but Congo was about sign language or language in apes, in higher apes. And so in that one, they found this group of apes that had been taught sign language 4,000 years before, and they were still teaching it to their young. They passed it down. Totally missed the boat in the movie. They were just, giant white gorilla monsters. But in Red Son, the idea was that evidence in the future may not be able to be reliable because they had a guy who murdered somebody and then they swapped faces and digitally put a different person's face on this guy in this surveillance video. And at the time, that was like, oh my God, this is revolutionary. This is a crazy idea. But now, with what do they call the face? What's it called when you? Not a false face, but anyway, when you change somebody's face, they do it with Dave Landau every day. He's Anthony's partner, and they take music videos like with Cardi B, and they just put Dave Landau's face on there instead of hers, and it looks exactly like him. The first one I saw, I was like, I thought he did it.
Oh, wow.
I thought he dressed, put on a wig and some kind of push-up bra and stuff, and was running around. It's so perfect. So. So if somebody comes up with a memo, a lot of people, unless it's corroborated internally, a lot of people just say it's fake. Mm-hmm. We don't believe anything anymore.
No, hell no.
I don't know how we're going to get back to where we do believe stuff.
I think it's a long time gone, as they say.
Well, maybe. I think one of the things is removing the anonymity on the internet. Although Facebook, it doesn't seem to matter.
No. Care less.
Yeah, people are less anonymous on Facebook. They still say goofy stuff. So I don't know. Anyway. All right. So, but that's really good news. Mm-hmm. It's really good news. Mm-hmm. And we only have to get 40-50% of people to do it. And I think we'll get 60-70% of people to do it once it comes out. People were worried about transporting the Pfizer vaccine. It's got to be kept in
super cold.
Super cold. I thought it was 40 degrees below zero. It's like negative 100 or something like that. But they have a technology for shipping it. They can ship it to a doctor's office in this box. And I can't remember what they called the technology. It's like neutral temperature or something like that, but it's just super insulated, and it can sit on your desk for a week and still be good. And as long as you give it quickly, then it'll be fine. So I was trying to imagine these trucks that had refrigerated units that were negative 120 degrees Fahrenheit, and there's none of that. Yeah, they won't have to do that.
That's cool.
They came up with something for that too. That was my biggest concern. But they said, that won't hinder people getting it at their local health department if they have to do it that way.
Wow.
Yeah, pretty cool.
That is cool.
All right, ready to take some questions? You guys have anything else?
Number one thing, don't take advice from some asshole on the radio.
Boy, that really is true, isn't it?
Mm-hmm.
Too late.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
All right. Oops.
Mike from New York calling. What's the deal with all this coronavirus stuff they're selling? It all says antibacterial.
Right.
The coronavirus is a virus.
Right.
So what's the antibacterial stuff supposed to help with corona? Does it, or is it just a marketing idea?
No, I love this question because it would be confusing, particularly if you think critically about things. Obviously, antimicrobial medications like antibiotics don't work against viruses, right? We keep telling people don't take antibiotics for a cold, for example, because it increases antibiotic resistance. But that's a different thing. Antibiotics tend to work by targeting some mechanism in the bacteria that causes them to that allows them to reproduce. So we, either target the cell wall to make the cell walls break open, or target their ability to reproduce, whatever it is. And obviously, that's not going to work against viruses because they work differently. But antibacterial soap, for example, will kill a virus just like it will a bacterium because, matter of fact, it'll probably kill the virus easier because viruses are very vulnerable, most of them, to soap and water because they're just these little naked machines and they've got protein and lipids on their surface, right? Little clump, molecules of fat.
Right.
And soap solubilizes fat. So the second you use soap and water, the viruses are inactivated. Bacteria can be a little bit more hardy than that, particularly ones that sporulate, in other words, make spores like Clostridium difficile. Clostridium difficile causes C. diff, causes pseudomembranous colitis and causes severe diarrhea, and it can be life-threatening in some people. That one, my understanding is, when it gets threatened, it'll make spores, and those spores are really hardy. I mean, they're hard to kill, and it's really hard to sterilize a room and kill all spores of things. And fungi can make spores too. So really the viruses are going to be more vulnerable to an antibacterial soap than maybe even some bacterium are. So,
good question.
All right. Yeah, that's an excellent question.
That was a good question.
I liked it. All right.
Hey, Dr. Steve. It's Matt in Charleston. How are you?
Good, man. How are you?
All right. Hey, so listen, I'm seeing a chiropractor because I had some back pain in my lower back. And I've always been very skeptical of chiropractors because of a lot of the kind of not doctor, not science stuff that surrounds that. How much of that is true? Is chiropractic legitimate medical practice or witch doctory? Let me know.
Yeah. So they call it chiropractic, not chiropractic, but that's all right. So, look, we used to have Dr. K on here. She's a chiropractor, and she tragically, lost her life to breast cancer after, a multi-year fight. Mm-hmm. But we had her in here, and we'd talk about this kind of stuff all the time. There is evidence for chiropractic manipulation, particularly for low back pain. So I have no problem with people if it helps them go into a chiropractor, particularly for the things that they're indicated for. Where I get a little bit wonky about this is, and it's not just chiropractors by any means, but it's when people are practicing treating people, and they're using things like coffee enemas for cancer, and when they get outside sort of their the realm of evidence-based medicine, and that's when I start having problems with it. So if it's not going to do any harm, it's not that big of a deal. But when you're substituting that for other things that really would help, then that's when I have a problem with it. What sayest thou, Scott? Because you're classified as an alternative medicine provider, even though we could argue whether that's an appropriate label for you, given that.
Yeah, anymore it's not so.
Yeah, I mean the evidence
so
for what you do, as long as you stick with the things that there's evidence for.
Well, and it's the same thing. Us chiropractors, physicians, it doesn't matter. Masseuses, if you have somebody giving you bad advice and practicing out of their scope, I have a problem with it. Period. Right. I know I know some chiropractors, and Dr. K was one of them. That are just brilliant people and do great work, and but know when to share and when to send people out for things that they cannot treat. Yeah, and she was very good about that. The most of the times I'm a huge supporter, but shit, it's like everything else. If somebody's doing something wrong, then they don't need to be practicing.
Right. So
how would someone know that?
That's what I was just going to say is how would the patient know?
Well, so here's what I tell people. If you've got someone telling you that they can take care of everything you have. For instance, I had a guy with Bell's palsy that came in because he had a sinus infection. This chiropractor said he could cure
Motion
his...
detected at the front door.
Sorry.
His sinus infection by manipulating his ear, right?
Yeah.
So he jerks on this guy's ear to treat his sinus infection, gives him Bell's palsy. We never could fix his face.
Oh, yeah.
I tell people they should be skeptical when they come in to see me.
Yeah,
just
and
like,
me too.
And anybody else, you need to see all of the documentation, all of the requirements should be not hidden, and there should not be any kind of deceit.
And that's hard to determine too. But anyone that starts trashing everything else that was done before, that is a red flag.
Huge red flag.
If they start to try to isolate you from other things, that's almost that cultish sort of
try
behavior.
Selling you on stuff that's not. If you're in there and they're trying to sell you shoe implants, and it's like, wait a minute, what exactly is your job?
Yeah, if you're upselling, that's a problem too.
That's a huge. And if they refuse to refer out or call in other docs, that's a huge red flag for me. And again, that's across the board. It's not just one. It's everybody.
No. We're not just talking about chiropractic.
It could be
We're
physical
talking about
therapy.
any quack.
It doesn't matter. So,
okay, hang on now. My kid is calling, so I'm going to have to put him on the air real quick. Liam, you're on Weird Medicine. What's up, buddy?
I got low oil pressure in my car, and one of my tires has low PSI.
Okay, so where are you?
I'm in the neighborhood, but I got to take a long home.
Okay.
I'll do it.
Yeah. Just come up and park your car, and Mom will take both of you over there, and then we'll get it figured out, okay?
Okay. Thanks for you driving right
now? Yeah, you're in the neighborhood, right? So just bring it back to the house.
Okay, can I drive to school tomorrow?
Well, we'll see. We gotta look at it.
I'll teach you how to fix it in just a minute.
We got to look at it, buddy. The low oil pressure is fixable, and the low tire pressure is fixable. So, but we'll look at it here in a minute. Okay.
All right, I gotta hang up. I gotta do this.
Okay, pal. All right. Well, I gotta hang up too. I'm doing a radio show, but thank you.
All right, goodbye.
You got any medical questions?
Oh my gosh, that's funny. But Dr. Steve, I tell people, good medicine is medicine that's appropriate for you.
Yeah.
And I don't care if it's a hug or a kick in the ass or a brain surgery. If it's what you need, then that's what you need.
That's right. Well, they did. Here's a systematic review. They did 23. Oh, this is a systematic review of systematic reviews. They found 23 chiropractic systematic reviews. 11 articles met the defined criteria that they were looking for. The results showed the influence of chiropractic on improvement of neck pain, shoulder, neck trigger points, and sports injuries. But then when it came to asthma, infant colic, autism, GI problems, fibromyalgia, back pain, and carpal tunnel syndrome, there was no conclusive scientific evidence. There was heterogeneity, and some of the studies also limited number of clinical trials. And it's hard to do sham chiropractic treatments too, so it is hard. Yeah. It is hard. But the thing is that if it helps you, and it's not hurting anything, then it's fine.
It's a good thing. Yep.
But I have heard of people that get their neck wanked, get the crack in their neck, and they do the forceful cracking of the neck that have had strokes and stuff from that because it'll kick
and quads
what am I?
Blood clot.
A blood clot, like a plaque off of the inside of the vessel. And so, but a lot of chiropractors that I see are going to the more low impact stuff. They got the thumpers now. They're not cranking around and doing stuff really.
They're using those activators a lot.
Yep.
And I'll see those activators used, and I think it's a lot safer.
Yeah. And it seems to be just as helpful. So, if you're a chiropractor and you want to talk to us, if we said something that's BS, that's fine. But, we're not crapping on chiropractors at all for what the evidence says they're good at.
Yeah, for certain things, it's wonderful.
Yeah. So, all right. Very good.
Hello, Dr. Steve. Hey, sir!
Oh, it's Stacy Deloach.
Really enjoyed getting to do the show with you last week.
Yeah, that was fun.
We left something hanging in the air that we never did go back to.
Yep.
What is the difference in a CAT scan and an MRI?
Oh, that's a great question.
Close cousins of each other, or two?
Yeah, he did ask this question, and we never got to it. So, CT or CAT just stands for computer-assisted tomography. So, in computer-assisted tomography, you take a bunch of pictures in a rotating plane, and then you stitch them together to make pictures of cross sections that you couldn't have gotten otherwise.
Right.
So now if you've ever seen an MRI or you've seen a CT scan, they're both computer-aided tomography. Mm-hmm. So the CT scan was the first type of computer-aided tomography that we used. So it got to keep the name. Mm-hmm. It's like Frigidaire, right?
Right.
And it got to keep the name, but really, it's really an X-ray computer-aided tomography, whereas an MRI is a microwave magnetic resonance imaging computer-aided tomography. So the CT scan, you've got this head that spins around, and as you move through this spinning field, it takes a bunch of pictures, and then the computer can stitch them together to make a cross-section. Right. So that like you're taking somebody and they're laying on the table and you're just taking slices. And you can slice it all kinds of different ways, from the side, from from front to back, head to toe, the whole thing. It's pretty cool. MRI is different. It uses microwaves and a really high-powered magnet. And we've discussed how it works before. We've just got a few minutes, so I'll take a second just to discuss how it works. When you go in that high Tesla magnetic field, it causes all of the hydrogen atoms in your body to start aligning and they spin together, and they will precess like a top. So if you spin a top, and if you look at the stem on the top, it'll start to spin around, just like the Earth kind of spins on its axis, right? At a 20-degree angle, you'll see the top starting to spin like that. Well, these hydrogen atoms will do the same thing, and they'll all spin and precess at the same rate. Then you throw in microwaves, and some of those photons of microwave electromagnetic energy will cause these spinning hydrogen atoms to flip. They'll attain a higher energy state because they'll absorb one of them. Mm-hmm. And then if you keep applying that frequency, they'll start to release their photons at a certain energy level and then pick up another one. And so they'll absorb at one energy level and release at a different energy level. And those released photons are the ones we're looking for.
Right.
And then you have a detector that detects those. And then you can make pictures out of that too. So the cool thing about MRI is that different chemical bonds will cause these hydrogen atoms to flip at different frequencies. So you can kind of look and say, oh, well, now that's water. Right. This over here is cerebrospinal fluid, that kind of fat,
nerves,
stuff like that. Yeah. So it's really freaking cool, and it makes a really detailed picture, but it takes longer. It takes like 45 minutes to do one of those. But anyway, so they're both computer-aided tomography. But an MRI uses a different technique using magnets and microwaves, whereas the normal CT scan that you're thinking about uses X-rays, very low-dose X-rays. Okay? All right. Very good. I think we have time to do this one.
Hey, guys.
I know, it's weird. I got a question.
Oh, my God.
Anyway,
it's him again.
Saw on Facebook where metformin has been recalled. I take it twice a day, 500 milligrams. Does the manufacturer...
Yeah, okay, so we're running out of time, so let me just get to this. Thank you, Stacy. 2 good questions. Oh, yeah. The FDA is alerting people to a single laboratory. It's Nostrum Laboratories. They had a voluntary recall of 4 lots. That doesn't mean all of theirs, just 4 lots of extended release metformin, not even the normal short-acting metformin. Metformin's a drug that you can use for diabetes. It decreases. It's kind of like Atkins diet in a pill. And they're recalling metformin because it may contain this N-nitrosodimethylamine, and that is a chemical that is known to be a contaminant and can cause cancer in animals. So it's in high doses. It's hepatotoxic. In other words, it causes
liver,
problems with the liver. Right. So NMDA can be produced by water treatment and by chlorination, and the question is just the level at which it's produced in the United States. So cured meat will also have these nitrosamines. We've talked about nitrosamines before. This is the NMDA is the smallest nitrosamine.
Okay.
So can be found in low levels in cured meats, fish, beer,
oh no,
tobacco smoke, very naughty, quit smoking.
Yes.
And also there is a rocket fuel that is a effective precursor to NMDA as well, but that's, the only thing that we're worried about in that regard is groundwater near rocket launch sites can have high levels of NMDA in it. So anyway, this isn't a reason to get rid of your metformin. No. Just talk to your primary
or your pharmacist.
That's what I meant. Your primary pharmacist, and see if your metformin falls under that recall. If it doesn't, you're fine. Mm-hmm. All right. You want to do another question? Let me see what we've got here. Oh, yeah. Here's one on organ donation. Let's
Hello, Dr. Steve.
Hey.
I have a stupid question for you.
No such thing.
If somebody is a organ donor,
right,
and they pass away kind of
suddenly,
unexpectedly,
yep,
and they donate their organs while they're still alive, right? They keep them alive to donate their organs, and then they send the body over for autopsy. How do they do an autopsy without?
They can't.
The vital organs like the heart,
right,
the liver, the kidneys, the lungs.
Yeah. So if
let's say somebody had a massive heart attack, and they donated their heart, how do they autopsy that?
Yeah.
All right.
Well, so a couple of things. The people that can donate live organs are people who are brain dead. And so these are people who have deceased. They have no brain function. And we can, believe me, determine that pretty easily. There's a nuclear blood flow study to the brain, and it'll show there's no blood flow to the brain. Right. If there's no blood flow to the brain, you're dead. Back in the day, if people stopped breathing, they were considered dead. This would have been, in the 1800s or something. If you stopped breathing, they died. And then we invented respirators. Mm-hmm. So stopping breathing, we could do something about that. So just stopping breathing couldn't be it. So we said, well, okay, if their heart stops, then they're dead. Mm-hmm. Well, okay. Except now we can do CPR and shock people and use drugs and pacemakers and stuff like that. Some people we can sort of bring back from the brink.
Or ECMOs.
Yeah, sure.
Like the poor guy that was hiking the other day.
Oh, what happened with him?
Well, just to kind of go on with what you're saying, the gentleman was an addict formerly. He got off drugs, hardcore drugs, and he had gotten into hiking, and he was an avid hiker, and got out and got stuck in a kind of a freak snowstorm. They found him. Researchers found him like 2 days later. And he was
researchers. You mean search and rescue?
Search and rescue. I'm sorry,
researchers.
I apologize. Yeah, but the search and rescue guys found him like 2 days later, brought him into the hospital, And they did CPR on him for 45 minutes.
Oh, he was cold.
He was cold. His body temperature was, I think they said it was 30 degrees lower than what it should have been.
Right.
I was 68, roughly.
He was in suspended animation.
They put him on ECMO, which is kind of what you're describing now, which is a whole other thing, an ECMO machine, which helps to balance out his oxygen and carbon dioxide, and while they were working
on his heart. Extracorporeal membrane oxygenation. So this is just basically where you're taking blood out of the body and then oxygenating it somewhere else. So you're not using the lungs to oxygenate the blood, right?
Yeah.
Okay.
And brought him back.
Wow.
Sucker was long gone.
And his brain functions normal?
Perfectly normal as of now. And
we hear this with kids a lot. Kids fall into a lake that's frozen. They fall through the ice. And, you can't just swim back up to the surface again because you move and you can't find the hole and stuff.
No.
Some of these, the kids, when they'll find them, it'll be 45 minutes, but you don't give up until you've brought them back to their whole body back to room temperature, because many times they will survive that and have no deficits from it.
Incredible.
But they have to be resuscitated properly.
Yeah, slowly. Yeah.
So stop your heart stopping by itself can't be the sole criteria for death, right?
Right.
So right now, we say permanent absence of brain function, you're dead. And that's going to carry us for a while until we can somehow scan somebody's brain and get the quantum state of every neuron, and then turn that, transmit that to a computer where they'll wake up and go, whoa, wait a minute, where's my body? And then we won't be able to say brain death is death either. But until then, we don't have that technology. It's going to be a while. So we're going to say, your brain dying is you're dead. So people who are brain dead but are on the ventilator, their body is still functioning. Their kidneys may still be perfusing. Their heart is still pumping. They can't breathe because they have no respiratory drive because they're dead.
Right.
So they have to be on the ventilator. And if you take somebody off a ventilator and they start breathing, they're not dead. They're not brain dead. And that's one of the tests for it. As a matter of fact, is a thing called an apnea test. If you think someone's brain dead, you get them highly oxygenated with 100% oxygen. You can get somebody's oxygen up to like 700 doing that. And then you remove the tube and watch them for 10 minutes. It's the longest 10 minutes of your career, watching somebody, and you check their vitals every minute. And you watch for respiratory attempts, any attempt. Any attempt, and they still have some brainstem function, they're not dead. But if they don't breathe, they don't even try, and then their carbon dioxide goes up by a certain amount at the end, so you have to do a blood gas before and after, then you can declare the patient dead.
Okay.
And people get into trouble declaring people brain dead when they don't follow the protocol. If you follow the protocol, so now you've shown there's an absence of brain function, brainstem function. You got to now show that it's permanent. Because if I just give you enough propofol, I can make it look like you're brain dead. Right? I can make it look like you can't breathe. I mean, you won't be able to breathe on your own, and you won't move, so you'll look like you're brain dead. So just that one test isn't enough. You have to now prove that the lack of brainstem function is permanent. So before you even start, you got to rule out drugs, hypothermia, like you just said, all those things. You got to make sure all those things are controlled for before you even start this process. Well, anyway, so one way to do that is that cerebral blood flow study. And so if you have an apnea test that shows no brainstem function, and by the way, they can't have reflexes either. You do that before you do all of this stuff.
Sure.
And I'm talking about brainstem reflexes, corneal reflex, like when something gets in your eye and you blink, that kind of stuff. So all of that's got to be going. They can still have spinal reflexes, like people who are brain dead can still get erections and stuff. So that doesn't mean anything. As a matter of fact, there have been people who have been hand jobbed to completion while they were brain dead just to get a sperm sample. Which just goes to show you, even a brain dead dude is still, sexist.
Still loves it,
right? But anyway, so you go through all these things and show that it's permanent. And then you can start thinking about harvesting, quote unquote, organs for organ donation. All right. Oh goodness. Oh, you ain't got the covert, do you?
Hardly. I got the leaf mold. Is what
well, then I'm getting paged, and I didn't even work today. So anyway, I guess we better get out of here. But that's the deal. So you can't really do a complete autopsy and donate your organs at the same time. So
good question. That wasn't stupid at all.
No, it's not stupid. It's a great question, and there may be exceptions to that as well. So. And if anybody knows of one, I'd be happy to hear it. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, Holly from Port Charlotte, Louis Johnson, Paul Ovcharski, Eric Nagel, Roland Campos, Sam Roberts, Pat Duffy. Do I say Jim McClure on here anywhere? Have I not said Jim McClure this whole time? Oh, my goodness. Okay. Dennis Falcone, Matt Kleinschmidt, Dale Dudley, the great Rob Bartlett, Bernie and Sid, Ron Bennington, Chowdy from Florida, Fez Watley, Chrissy's sister, and all those people who supported this show has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, on demand, and other times, at Jim McClure's pleasure. Yeah, so he doesn't get mentioned twice. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com, for schedules and podcasts, other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thank you, Scott.
Thank you.